Dr. Arctic Majan here at Deuk Spine Institute. I'm here with one of my patients who, she just had the Deuk laser disc repair done yesterday, and we did 2 levels, right? L4-5, L5-S1. And you had the laser surgery done on your disc, but you had 2 herniated discs that were causing back pain and pain going down your right leg with some numbness in your toes. Why don't you tell us about your problems before surgery? What were you having exactly?
I would have a lot of severe back pain in my lower back and a lot of pain down my right leg and numbness in my last 3 toes, I guess it was.
Okay.
And be like excruciating once, like off and on.
And so that pain that you had in your lower back before surgery, do you still have that now?
No.
It's gone.
No, it's gone.
And the pain down your leg?
The pain down my leg is gone and I can feel my toes.
Awesome.
Yeah.
And it's going to stay that way, by the way, as long as you don't mess things up like we talked about.
I'm going to try not to.
So another patient cured of back pain and leg pain with the Deuk laser disc repair. How big is your cut on your back? You watched the surgery. How big is your cut? Show me with your fingers.
Maybe like that big?
Yeah, that's right.
Something like that?
7
half
millimeters.
an inch or something?
Yeah, 1/4 inch to half an inch. So, are you glad you didn't have fusion surgery?
Yeah. I've already had a fusion in my thoracic and that was horrible.
Yeah, we saw that.
So it's like way better.
Yeah, and you had an accident.
Yes.
2007 was it?
2006.
2006, you fell off the horse?
Yep, I broke my back.
So, are you taking any pain meds because of the surgery it did? Do we give you pain meds for that?
The Tylenol and
Tylenol, right?
yeah, it's like Tylenol 3.
And have you needed
Robaxin?
it? Muscle relaxer, Robaxin.
I definitely needed it like last night, but I was sore, but I think it was like the release of pressure like on my nerves, but today it's like way better.
Yeah.
Yeah.
All right, is there anything else you want to tell everyone?
I would suggest doing that before you go and get another fusion or a fusion.
Yeah, doing the laser surgery, right?
Yes.
It's much faster recovery.
Yeah. I wouldn't have walked out of here. I wouldn't be walking right now if I had another fusion.
All right.
So, yeah, I would suggest it. Thank you.
All right, go take care of yourself.
I will.
All right, enjoy life.
Yeah.
All right, guys, thanks.
Try.